First of all, I apologise if you've come hoping to see Jenny Harries. You've got me, I'm afraid, still as her deputy, so I'm the Deputy Regional Director for Public Health England. Nicola and Sophie, who are here, spent a lot of time trying to get, on Friday nights, trying to get Jenny as sustainably as possible somewhere and staying in as sustainable way as possible. So I do apologise that she can't make it. She really wanted to, but got called away, as I say, on Friday. Question thing is how do I now follow that? So that's the other thing. If anyone's seen me present before, you'll know I take either a Jeremy Vine or a Peter Snow approach and like to move around and throw my arms around when it comes to presentations. I can't do that today, so I apologise if I don't quite see all of you, particularly around the lighting. So I apologise about that. So I'm going to be talking about the current strategic context in terms of sustainability and health in the South region. When it comes to public health, we often take this sort of approach. So we start talking about prevention versus cure. So we take we can take quite a dichotomous view of it. So saying either, you're that person who's trying to turn off that tap of disease, so you're trying to prevent it, as opposed to that person who's trying to, with a fairly ineffectual mop, trying to do it once you've already got the disease. Which I think is quite an interesting bit, and we know from kind of good, cost-effective, information that it is definitely more cost-effective to prevent the disease in the first place. But the nice thing about talking here and talking about green space is it takes you to a different paradigm completely, I think. So that's kind of quite negative. It's always thinking about disease and, and all of those kind of approaches. But when you think about the green space, it takes you into what we would call in a technical way looking at assets, but looking at the positive things and how do you enhance the use of the kind of positive elements of the assets that you've got in your local communities already. So instead of the tap, we've got this lovely waterfall, and so you're trying to kind of almost encourage the waterfall. You've got this collection of asset then in the natural environment, and then the question is with your fairly ineffectual mop is how do you really wring out the best benefits in terms of health? The other thing that's quite nice is it doesn't talk about disease. And actually you could take a much more of a sort of a health and well-being approach to it. So you start thinking that, instead of these paradigms of things like, if you're not ill, you must be well, and if you are ill, you can't be well, becomes very artificial. We're all on a very complex health and well-being journey. And the benefits that you can get out of the natural environment is actually all about, you may be unwell and it is helping you with your care, your support, your feelings of wellness and your cure. So it can be at the curative end. And actually if you're in that spectrum, it may also then be preventing other disease coming on as well. And then it could be just in the pure prevention side. And then I've got those pictures in the corners, which is family pictures. Which is, you can get your benefit from the environment in different ways. From, in the top right-hand corner, kind of quite active in the Avon Gorge, to being also quite sedentary, perhaps, in the bottom left corner on the south coast. But again, you're getting benefits. You're getting health and well-being benefits from the environment. Just making sure you're all awake. So I'll try not to keep on doing that. So I then moved, so this is where I had trouble with this presentation, because I'd been in this kind of staring at this, thinking about this lovely eulogy around health and well-being, and then I moved to that slide. So I thought you ought to know about the boundaries of STPs. And if anyone is doubting the benefits of the green space, think about how you're feeling then when you see this. So I apologise, but these are the boundaries. And then as you were saying, I think how the boundaries interact with nature partnership boundaries, I think, are important. So we know there are some areas where they've worked well together, where we know some nature partnerships have already been involved in this STP kind of environment already as it's been evolved. I know Dorset in particular certainly has, and there are probably lots of other views that have been involved in health and wellbeing boards and actually engaged in this. But anyway, what I did do is I decided we're going to put at least a bit of green space on the slides. So as it starts going down through more and more STP language, at least there'll be some green space. So I'm talking about the context. So the sustainability and transformation plans were all about thinking about how these three gaps may emerge over the next 5 years. So looking at health and wellbeing gap, looking at the care and quality gap, and looking at the finance and efficiency gap. And that's what their idea is. What can they do? What can we do together at a local level, or a slightly, if you can call STP footprints local, but slightly larger than what you often sort of think of as local? What can we do with benefit to help against those three gaps? And it is in a tough context. You know, we know what the context is when it comes to investment so far. In things like local government, they've had, huge cuts to their budget already. And then we can just see with the health explosion how much more difficult it is to actually continue to fund the NHS at the current state and the current way of working. We've got to do things differently. It's lovely working with Nigel and Caroline from NHS England because they are such advocates for doing things on sustainability. So actually it has been a delight in the South, I think, and I think we've done really well giving advice early on to the leaders of the sustainability and transformation plans about things that they can do. And actually, if they're not thinking about sustainability, it's not going to be a sustainable plan. So actually, let's live up to them being called sustainable transformation plans. So we've still got green space, still got a lot more words on this one, so I apologise. And actually, this is part of the extra bit of information that we gave and wrote out to all the STPs, just so that people were clear about the sorts of things. So trying to make it as easy as possible for local STPs to do something around sustainability. Just going to move the screen slightly. Right. So when they come to become published, so at the moment they're still draft, they're still working with partners on the STPs. If when they come to publish, you avidly look through it and say, well, actually, I want to now find the bit that says about how we're going to use the green space for health, you might not find it written very large in most of the plans. But you will see these sorts of themes. So you will see they're about empowering local communities to improve their own health and well-being. It will be about helping with self-care and support. It will be supporting people with mental illness with their physical health needs. It will be supporting people with physical illness with their mental health needs. Supporting carers and those with dementia, giving children the best start in life, reducing loneliness and enhancing community cohesiveness, and then some bits around improving physical activity, reducing the prevalence of diabetes and its impact, reducing falls and reducing inequalities. And as Sue's already said, lots of people struggle about how do I reduce inequalities, and yet this is one of the strongest evidence-based bits about things that we can do to truly get to the root parts of inequality. So, you might not see green space in sort of the first page, but you will see themes that you can all engage with and can all help and bring benefits to. When I saw the number of people who were coming and where all your skills and all of your knowledge, I thought, it's going to be really quite difficult to actually share anything that you don't know already. So, what I did think, throw in this then. So there is a short-sightedness epidemic that my optometrist told me about. And I thought, I really ought to know about this as a public health physician. Surely I should know. But this is just a good prevalence data that shows that it's doubled in children the amount of short-sightedness. And there are two things that drive that. One is clearly a lot of close work, whether that's paper or whether it's screens, but also very much not outdoor play at a young age, not having outdoor play, not seeing, not really having to focus into the distance much. And actually, this is one of the bits that people are really trying to push about. Think about screen time, think about outdoor play. So you definitely won't see that in the STPs, but again, another little hook, think about the benefits and the advocacy that you can use for those young people as well. So that was about the only thing that's new that you probably don't know, so I apologise. The advantage of changing the slides around now is that I can now cover this thing about what we mean by sustainability and what we think sustainability and transformation plans should be about. And that's about thinking about clinical sustainability, social sustainability, environmental sustainability, and financial sustainability. And if you don't try and hit that bit in the middle, you will not be sustainable in any of those areas. That if you think about in the next 5, 10, 15 years, you've got to be aiming to try and hit everything in the middle. And that's the challenge. Because you won't be sustainable on any of the fronts in the long term. So, some good news. So this is the mean study from Natural England. Lots of you will probably know it already, but they asked people in the last 7 days, have you engaged with the outdoor space? And if you have engaged in the outdoor space, did you use it for exercise and health reasons? So, and this shows that, for the southwest, so improving trends throughout. In the southwest, showing you've got now through 25%. So a quarter of the respondents were using the outdoor space for health benefits. So a real benefit from that. And the southeast through the 20% barrier as well. So an improving picture, which is always positive and reassuring. Don't worry about the actual variation because this is from a survey, so there is some variation sort of built into the survey technique. But actually, you will have this information at a local level. And if you want to know about your trends at these sort of the more local footprints, you can just put in PHE and fingertips into some search engine. Google, Bing, whatever, and actually should come up as your first hit. In fact, on my computer, if you put fingertips in, it comes up as the first hit, but that might just be me. But you can find your local trend data, and you can start going at a more local level. So, and there's an awful lot of green space in the south. So anyone who knows me knows I like to draw a map. But this is using about the percentage of green space in each ward across the south. And you can see the predominance of green. And that means you've got at least 85% of your ward is green space. There's clearly another question about how accessible it is. But this is at least, we've got a huge resource there. And even if you're in one of the red patches, you can be up to 30% of that red patch is still green space. So there's a lot of resource out there. And David Pension's going to talk later about how you get the most out of urban green spaces in the WHO report. So finally, this bit that Sue's already stolen my thunder on is again, the evidence base around inequalities. And this is a report from Public Health England and the Institute for Health Equity at UCL about how, again, do you use improving access to green spaces to reduce health inequalities. And Karl Petrikowski, who I think is coming today, not here yet, is actually, was one of the authors of this report. So again, we'll be able to pick his brain later. There's support within Public Health England, without wanting to give you even more boundaries to worry about. In each of the Public Health England centres, so there's one for the southwest and one for the southeast, there is a lead person that really is there getting very engaged with the local sustainability and transformation plans and the leaders. And there's also a sustainability lead in both bits. So actually, again, we thought we'd put that up so you've got an idea of who can help you potentially with your engagement with STPs. So, just quick little thanks for the parts of the presentation, mainly to my family for the pictures, but also to the Sustainable Development Unit who really helped us thinking through early on about the STP role when it comes to true sustainability, and also to Amy and Carl from Public Health England, and a little bit from the NHS Photo Library. So thank you very much.